Hello, everyone, and welcome to the Holistic Mental Health Summit, where we help you create a life that is happy and fulfilling and free of any anxiety or overwhelm. So, today we have an awesome speaker, Dr. Talia, who is also a naturopathic doctor, and she's going to talk to us about how our periods can affect our mood. So, let's get started with her. So, Dr. Talia, would you like to talk a little bit about yourself, how you got into naturopathic medicine?
Sure, yeah. So it was a linear journey that took a few turns, but I studied my undergrad in pre-medical science and had my ups and downs in my own experience with the medical system where I felt like, so my track was to go into medical school, and I just, around second year of pre-med, felt like it wasn't the right path for me, and I took a bit of a break and moved into my more artistic pursuits and artistic interests. And I traveled abroad. I went to live in South America for a couple of years. And my time there, I started to get more in touch with natural medicine and discovered that was long story short, that was the medicine that I had hoped to practice all along. And I researched programs in Canada and learned about the Canadian College of Naturopathic Medicine. I went for an interview there, and I went for a tour, and I discovered it felt right. And I started studying naturopathic medicine, and so it kind of all came full circle. I ended up having all of the prerequisites, and sort of came about it in a little bit of an elliptical way. And my interest in mental health came when I was working as an intern. I was working with patients and trying to discover, people would come in with different concerns, digestive issues, fatigue, hormonal issues, and I saw that an underlying theme with all the cases I was working on was a depression or an anxiety, or one thing that told me that they were dealing with chronic disease or a chronic concern was this lack of happy mood. And I think health is our greatest asset, but even deeper than that, a good mood is our greatest asset, because even if your body isn't feeling optimal physically, if your mood is good, then your quality of life and everything is good. So I started focusing on that, and then just realizing how many people need help, I started to deepen my knowledge in mental health. And so here I am, and I work in Toronto.
Okay, that's awesome. So when we talk about women and different mood disorders or any low mood, anxiety, depression, it's become really common in today's world. What are some common causes of any mental health issues or mood disorders that you see in your practice?
Well, what we see, I'm looking at the whole person, but one thing I commonly see is inflammation plays a huge role in mental health conditions. And we know this from the research that really it is inflammation that starts to drive some of these we call them chemical imbalances. We know it goes deeper than that, but it's inflammation that starts to drive a lot of these mood disorders and issues with behavior that we see in mental health conditions. Mental health conditions really are, they're more like syndromes. They're a constellation of different symptoms. We don't have any blood tests, we don't have any imaging that tells us if somebody has depression or if someone has bipolar. You can't stick your brain in an MRI to get diagnosed. So it's really based on the symptoms that someone's experiencing and the behaviors that they're exhibiting. And so we're looking at what are coming together to create those behaviors and those symptoms. And in the research we see it's inflammation. But then my job is to look even deeper than that and see what is causing the inflammation that might be driving somebody. Because historically, or generally, when we are experiencing inflammation, we feel pain, we feel swelling, we feel often like a redness or heat coming out of the area that's inflamed. But we don't often see that in the brain. We just see this disruption in mood and this disruption in how we're interacting with the world and how we're functioning mentally. So we're looking for, what could be driving this inflammation in somebody. And we see there's various different causes. And I know today we're going to talk about hormones, which is a huge cause, especially in women. But it could be anything from blood sugar imbalances to chronic stress to an injury or an underlying health condition like diabetes, an inflammatory like autoimmune condition. So it stems from hundreds of different causes, essentially.
And that's so true, because that's the one thing, like I practice Ayurvedic medicine, and the one thing we always look for is the root cause, right? And we
Right.
try with inflammation, we talk about chronic low grade inflammation. So there are no signs that, your body temperature is not extremely high, you're not feverish, or you don't have a lot of like aches and pains, but you could just be feeling off. Like you don't feel 100%, you just feel something's wrong. Why am I grumpy? Like nothing seems right, but there's no exact reason. So that could be low grade inflammation. So because we're talking a lot about moods, and women don't connect the dots sometimes, right? Sometimes they don't connect the hormones to the anxiety or depression. I have seen a lot of my clients who try everything out there. They'll try antidepressants, they'll try anti-anxiety medication. Sometimes it works, sometimes it doesn't. They'll try different supplements, they'll try healing their digestion, but sometimes nothing seems to kind of work for them, because it's an issue that's to do with the hormones. So can you tell me that how do the female hormones really impact your mood?
Hmm. So our two main female hormones that we'll probably be covering mostly today are estrogen, the estrogens, the main one being estradiol and progesterone. And so a typical female cycle, if we assume the textbook female cycle is 28 days. The first, we can divide that up into two main phases. The first phase being when you have your period, and then the period leading up to ovulation. Right in the middle of your cycle, you ovulate. And then we have our, what we call the luteal phase, the last half of the cycle. So estrogen does kind of like an M pattern. It goes up at the beginning of the cycle. It has a bit of a peak during ovulation. It dips right afterwards. And then it goes even higher towards right before our period, about a week before our period happens. Mid-luteal phase, it's called. And then it drops off. And then we have our period. And after ovulation, similarly, estrogen or progesterone increases and it peaks mid-luteal phase and drops as well. And so we, normally in a healthy cycle, we're going to have these ups and downs in our hormones. Now, we know that, so when you look at a textbook about hormones, about estrogen and progesterone, or, how we describe what the birth control pill does, we see, estrogen increases the lining of the uterus and its, secondary sex characteristics like breast formation and fat deposition on your hips and all of that stuff, like when you go through puberty. And, progesterone maintains the uterine lining, and then when it drops, we have a period. And this is sort of what we know. When I was in pre-med and medical school, this is what we learned about what the hormones did. But then we started doing more research and figure out that there are receptors in almost all of our cells for estrogen and progesterone, and our brain has a ton of receptors for these hormones. And so they affect our mood just as much as something like serotonin or dopamine would. And not only do estrogen and progesterone interact with our mood specifically, but they also interact with all of our other brain chemicals. And so typically, progesterone has a bit of a calming effect, and this is very general, and estrogen typically regulates our serotonin and dopamine and norepinephrine. Now, it's complex because our hormones don't really work. Like, I think we understand things as this is good or this is bad, or this does this or this does that. But our hormones don't work that way. Our hormones work in networks. So our hormones are increasing something here and decreasing something there. But then they're also manipulating this. And so we see symptoms when our hormone levels are too high, when our hormone levels are too low. And it can be difficult to distinguish between, this is because you have high estrogen, this is because you have low estrogen. And also we'll see symptoms if the balance between the two hormones are off. So let's say we don't have enough progesterone to balance out our estrogen's effects, we might get symptoms. So it can be very complex in that sense. But typically, when we go through our cycles, and you said like a lot of your patients don't really put two and two together when it comes to how our cycles can affect our mood. And I find that with my patients as well. They'll come in and say something like, I've been struggling with depression, I've been struggling with anxiety, and I think it might have something to do with my period, because there'll be this week in my cycle where I feel great. And then there'll be this other week in my cycle where I feel horrible and everything affects me. I feel extremely anxious. I wake up with panic attacks. And then we start to do some tracking and we figure out that it is definitely there's this connection with their hormones. And so we know where to begin when it comes to finding those root causes to start improving their mood.
So what are some symptoms or signs that you can see in an individual that they have a hormonal imbalance?
Yeah, well, one of the things we notice, we start to work out a pattern in what they notice in their mood. So typically it goes like this, where, we don't always feel great when we're actually menstruating. But, what we tend to notice is we feel pretty good the week after our period finishes. And then we might start to notice, so some women will start to have symptoms mid-cycle, some won't. But we might notice things like breast tenderness, maybe a little bit of irritability, maybe a bit more anxiety. And then that might go away for a little bit. But then the week before the period, this is when women will start to notice that either they're far more susceptible to panic attacks, or they feel just more on edge, anxious, irritable. They start to notice more depression. Things start to bother them that never bothered them before. They also have physical symptoms like major bloating, digestive issues, breast tenderness, or breast swelling. They might start to get cystic acne and breakouts. And they might feel like this for a week. Sometimes it's 3 days before their cycle. Sometimes it's a week before the cycle. I even have patients who it's a full 2 weeks before their cycle. Then all of a sudden their period comes and then they feel better. Or they start to notice that this mood state dissipates and they feel much different. And so when I start to see that mood is operating on the cyclical level, and it seems like it can be triggered by circumstances in someone's life, but there's something else that's making them way more susceptible to these changes in circumstances. They're like, this thing that is affecting me during this week before my period, it's affecting me so deeply, and it's not, it's something that didn't affect me 2 weeks ago. I feel like it was still bad and it was still an issue, but I'm just having a harder time getting over this or dealing with this issue the week before my period. I'm noticing, this comment that somebody made is making me cry, or I'm waking up with panic attacks in the middle of the night, and I wasn't 2 weeks ago. And, and I have the same stressor that's been going on all month long. So when we start to see those patterns and we start to look at hormones as being an issue, and typically we call this PMS, or a more extreme version is premenstrual dysphoric disorder, PMDD. But I often see that mood, so someone with an underlying depression or anxiety, I'll see that mood fluctuates sometimes according to hormones, just depending on how sensitive we are to the hormonal ups and downs.
So a lot of women think that having premenstrual syndrome is really like, it's normal, right? So a lot of women, they're like, oh, it's my period, I'm supposed to feel horrible and I'm not going to feel happy. So how do you know that, it's PMS versus PMDD? And when do you know that it's time to seek some support, that what's going on is not normal, right? It's some kind of a pathology going on, or some kind of a hormonal imbalance going on. So when's the time you would tell one of our listeners, that okay, it's not PMS, it's not just PMS, it's time to get some help? So what would that be?
Well, it really depends. We all have a different, threshold for what we accept as normal. And I think what we often say in this field is like, there's common, a lot of people have this, and then there's normal. And common, what we accept, maybe we've sought help for something and people have just told us that we're fine and everything's good, so kind of carry on. We don't always need to necessarily accept what's common. So if you're dealing with an entire week where you're feeling just on edge or super irritable, then, if you don't want to deal with that and you want to investigate the cause, then that's always an option to start looking at, okay, how can I start to heal my hormones or to prevent these major swings in my emotional state throughout the month. I think that it can be, so a healthy menstrual cycle, we're going to have these ups and downs. That's just how it is, being, a female. You're going to have these ups and downs in estrogen and progesterone. But how susceptible we are to these ups and downs, like we can be on a nice kind of smooth period where we're transitioning slowly through, a little bit of a higher estrogen, a little bit of a lower progesterone or higher progesterone. Or we can be in situations where we're getting like huge ups and downs. And if you're noticing it affect your functioning, your physical health, or how you get through the month, finding yourself dreading the week before your period, then it could be an option to seek some help. I think sometimes, when our hormones are pretty smooth, we might notice a day where we feel a little bit irritable. I often find it's like women will look back on the day before their period and think, oh, right, okay, that makes sense. My period came. Oh, I noticed I felt a little bit bloated, or I noticed I cried a little bit harder at that commercial than I normally would have. Like, you know, that was kind of weird. But I think that when we enter into this state where it's, I don't even recognize myself, then that, you know, it isn't something we necessarily need to live with. When it comes to PMDD, that is, you know, so I mean, it's a diagnosis officially based on the DSM. We don't really know the causes of either of these conditions, PMS or PMDD, but it can almost lead to a situation where someone is experiencing very, very major mood swings, almost to the level of psychosis. And so we start to see it become quite extreme with PMDD, where it almost looks like a hormonally induced bipolar disorder or schizophrenia. So, or major OCD. So it starts to become something that completely prevents a woman from functioning. So, I mean, someone can get help at any point and just, you know, investigate our hormones, because we can be free from disease or free from symptoms, or we can be functioning optimally and, you know, really working with our cycle to feel as good as we can. So it really is up to the person and how they want to feel and what they want to accept as normal.
No, and that's a really good point, you know, because I come with like so many clients come to me with the same complaints, but they're like, oh, you know, but it's normal, you know, I'm just achy, but oh, I'm getting old, you know, it's normal. And I'm like, no, it's not normal. Common and normal are two different things. So thank you so much for pointing that out. And just because everybody has it doesn't mean you have to have it. And the second point that you made was really good, that if it's interfering with your life or quality of life, it's time to get help. And if you're still not sure, and if you're not sure that you're functioning optimally, right, because you could just go on living, but you could also live optimally where you're completely energized and you have happy mood and you're leading a really intentional and happy life. So if you want that, you can always get tested, get your hormones checked, or start working with a practitioner. Now, what are your thoughts on menopause? Because menopause is one time, and I'm also seeing a lot of clients with early menopause, right? So when we look at our mother's age, you know, the menopause was about 55. Even the textbook says 55. Now we start seeing women in the early 40s. I've even seen some in late 30s who are going through perimenopausal symptoms. Some have actually hit menopause, and that can impact your mood to a lot of extent. So what are your thoughts on how does, you know, waning of those hormones impact your mood?
Right. Well, we have, you know, menopause and we have perimenopause. And so some women will experience very little perimenopause. They go from, like my grandmother in Italy, or my grandmother, it was like I was menstruating once a month and then I wasn't, and it was done. And then a few years later, I got a mustache and that was great, you know, so, but then you see women in our modern society who are going through years. I have patients who for the past 5 years have been going through perimenopause, which could consist of periods that are coming every few months, but you're still getting them, or periods that are happening multiple times a month. And really we diagnose it officially as menopause when you haven't had a period for a year. So, you know, you could be going like 8 months without a period, and then all of a sudden you get a period and it's like, okay, officially not in menopause at this point. And, you know, what it's characterized by is these real hormonal ups and downs. So we typically, what happens is we stop menstruating, we stop ovulating, and so I'll put up a picture of that hormonal cycle that I described earlier, but we only get a rise and fall in progesterone after ovulation. So if you don't ovulate, you don't get that progesterone rise. And so, you know, okay, so the first thing that happens often with perimenopause is the progesterone goes low, and estrogen might still be cycling normally, at least initially. So you start to have a deficiency in progesterone, which typically creates a calming effect on the body, because one thing that happens to progesterone is it gets changed into something called allopregnanolone, which calms us down. It's kind of like natural Ativan, just kind of zens you out, chills you out, helps you sleep. It's anti-inflammatory, all those good things. But all of a sudden now that almost like the bottom's dropped out of your hormones and you no longer have those effects. And you still have estrogen. So you don't have, and we talked about how they work together and they balance each other out. And so we end up with something called, in natural health communities, we call it estrogen dominance, which essentially means that the amount of estrogen you have relative to your progesterone is imbalanced. So you have too much estrogen compared to what progesterone you have. And there can be different causes of estrogen dominance. You can have it when you're not perimenopausal, but one of the causes when you're perimenopausal is your progesterone's too low. So often women will start to get inflammatory symptoms, anxiety symptoms, irritability. Then eventually, after you've stopped having periods for a while, estrogen starts to drop as well. And estrogen's kind of going up and down like mad. And so you're getting these drops in estrogen. And estrogen, it boosts our dopamine. It's like motivation, focus, chasing the goal. It also boosts our serotonin, which is sort of like our happy, pleasure, sunny picnic with people you like on a nice day. That's what I think the serotonin is doing. And also our norepinephrine and epinephrine, which are like fight or flight hormones, but also make us feel pretty good, right? Like if you don't have enough norepinephrine or epinephrine, you can feel sluggish and tired too. So it's all about balance. Another thing that estrogen boosts is a hormone called brain-derived neurotropic factor, which is like a miracle grow for our brain cells. So when your estrogen levels drop, all those chemicals will drop too. And you'll start to feel more brain fog, like less cognitive function. But then when estrogen spikes high, you get a high level of these hormones. And notably, dopamine and norepinephrine and epinephrine are going to spike, and that's going to create more anxiety, irritability, like just that sort of like irritable dragon lady CEO type person. So when that's happening, it's like you're down, you're up, you're down and up. And then you also don't have this calming anti-inflammatory progesterone to just ground you. So, you know, what we see is just our balance, our network isn't working as well as it normally is. And our body is trying to adjust. I mean, menopause and perimenopause are normal and natural states. And really it's about a time of transition where our body is getting used to these lower levels of hormones, and it should settle out and start responding to them as needed. So it's expecting lower levels of hormones, and so it doesn't manifest as a deficiency anymore. But in our stressed out society, one thing that has to happen during perimenopause and menopause is that our adrenal glands, so these other hormone glands on our kidneys, they're supposed to now take over the production of our hormones. And they produce far less than our ovaries do, but they're supposed to sort of smooth that ride for us. But one thing that our adrenal glands are really busy doing is making cortisol, our stress hormone. And so it's like it's already overworked. It's already doing all the things it needs to do to get us through traffic, deadlines, early morning wake-ups, planning kids' programs, all that stuff. And now we're expecting those adrenal glands to make our estrogen and progesterone, and it's like, that's just not happening. So that rocky ride can last a lot longer, I find. And obviously there's many more causes than that, but that's one of the things that we see that differentiates our modern society from the kind of, 2 generations ago, easier menopausal transition that we see. So, yeah.
That was actually going to be my next question, that, we talk about hormones, impacting your mood, but what about your mood or your stressors impacting your hormones? And, didn't answer that. Beautiful.
And that's the thing too. It's like, I look at it as like this complex spider web. And if you tug at one string, which is sort of like, it's like, oh, you know what? It's the whole thing is that your estrogen's too low. Here's some estrogen replacement. Now that might be okay. And definitely that could be appropriate for a lot of my patients. I support them if that's the route they want to go down. But we're not as smart as our body, I think. And so when we're sort of just tugging on one string, what are we tightening? What are we unraveling by doing that? And so it's like really is this complex, interconnected thing where your stress hormones are going to affect your periods are going to affect your mood is going to affect your periods. It becomes this cycle. And I think part of my philosophy as a naturopathic doctor is that our bodies are very intelligent, and they're always trying to seek balance, and they're always trying to seek homeostasis. So you cut yourself, if you just leave it alone and remove any obstacles to cure, like an infection or something stuck in there, then your body will heal itself. But what often happens, and I see this happen a lot with hormones, is our body enters a vicious cycle where it can no longer correct. And so it could be stress affecting our periods, affecting our stress, affecting our periods. So we have our progesterone and estrogen affecting our cortisol levels, and our cortisol affecting our progesterone and estrogen. It's just like a vicious loop that worsens as time goes on. And really a big part of my job and a lot of what I need to do with people I work with is just somehow cut that loop. So start with one thing, either calm stress down, boost hormonal function, do both of those things maybe, and try and quiet that vicious cycle down, so that the body can go back into balance.
So what are some simple strategies that somebody can try right now to regulate their mood and calm their hormones down?
Yeah, well, the first thing, so I like to, it's often estrogen dominance that we're seeing, especially because that time is the week before our cycle, the week before the period. So that's when our estrogen levels are at their highest and our progesterone's at their highest. Usually, there's an imbalance between estrogen and progesterone, and that could be for 3 different reasons. One is that estrogen is too high, but everything else is normal. One is that estrogen is too high and progesterone is too low. Or another is that progesterone is too low and estrogen is normal. So I like to do blood work at that time, usually day 21 of a woman's 28-day cycle, to assess, what's going on there, to just get a snapshot of, what's happening. Are you making enough progesterone, or are you not clearing your estrogen properly, or is it both? And then from there, then we pick a treatment strategy. So with estrogen, it's usually about our liver function and our gut health. And also the vitamins and minerals we have, especially methylated B vitamins, that bind up the estrogen we don't need anymore and clear it from the body. So our liver is supposed to clear it through our blood, and then our gut is supposed to eliminate the estrogen that we don't need. And certain vitamins are important for breaking the estrogen down properly. It's like our garbage disposal symptom. If you don't take the trash out, it builds up in your house. If the garbage truck doesn't come and get it from the curb in front of your house, it builds up on the street. So our body has similar steps, and we have to eliminate estrogen properly. Otherwise, it builds up. And then the other part, progesterone being too low, is a lot about our adrenal function, like I mentioned before. So progesterone is produced by the ovaries after we ovulate, so we should ensure the ovulation is happening. But if it is happening, then we have to ensure that our adrenal glands, because it's also producing the adrenal glands, our adrenal glands are not overworked in producing cortisol. And also cortisol and progesterone play together as well. So then in that case, I'll use herbs in the class of herbs called adaptogens that help boost and regulate our stress hormone levels and give a little bit of a boost to our adrenal glands so that they can work a little bit better while trying to eliminate some of the excess stressors, which is easier said than done. Sometimes with women that have both of those things going on, we got to do both of those things. But it's usually one of those two things.
What are your thoughts on cholesterol? Because everybody is just scared of cholesterol and cholesterol containing foods like eggs or any kind of animal meats. And I know we're trying to go more towards healthy, but there's a definite link between cholesterol and progesterone as well, right? So for somebody who has really low progesterone levels, what's your take on that?
Right. Well, so, I mean, most of our cholesterol is produced by our liver, right? So if someone has high cholesterol, it's not necessarily because it's coming from the eggs that they're eating. And we know that dietary cholesterol doesn't really affect our blood cholesterol levels. It's far more complex than that. Also, our body creates cholesterol to make hormones with. So all of those hormones we talked about, cortisol, progesterone, estrogen, also testosterone, also another hormone called DHEAS, which is a male hormone. They're all created by cholesterol. Same with vitamin D as well. So they all start off as cholesterol and then they become these different hormones. So one of the things I would look for in women, I love looking at cholesterol panels, and I'm not always looking for, because it says a lot about our nutritional status. It tells you a lot more than just, oh, you need to go on a cholesterol medication, bring your cholesterol down, because it tells us, I often see cholesterol that is too low. And so that shows us that we need to start with the preliminary ingredient so that our body can even make the hormones. Because I could, give you all the herbs that you want and tell you to rest your system all you can, but it's not going to raise your hormone levels if you don't have the cholesterol needed. I see sometimes this in vegan diets, there aren't any plant sources of cholesterol, and so someone that's not eating any animal products whatsoever may have low cholesterol. Not always, because we do produce our own. But I'm always looking for, is someone making enough cholesterol that they can make hormones? And then if someone has too high cholesterol, so sometimes in perimenopause, cholesterol levels go up because our body's like, oh, maybe it's trying to balance itself out. So hormone levels are low, it's increasing cholesterol production. But one of the things that cholesterol does is repair cell membranes. So is our body increasing cholesterol production to heal something, right? Our body it often is responding to something. It's not dumb. So I'm always looking, if someone has high cholesterol, is there an underlying inflammation that we're not looking at that the body's trying to heal and trying to heal by increasing cholesterol production? So yeah, but definitely if someone's on a cholesterol lowering medication, that could potentially affect our hormone production. Yeah, it's a good point.
Yeah, no, that's really good to know, because that's one of the most common myths that people have, eggs and cholesterol. And
right.
What are your thoughts on tracking your periods and tracking your mood? Like, do you ask your clients or patients to keep a track if they're suffering from a lot of symptoms, or are there any good trackers that you suggest?
Yeah, there are. So I mean, there's all different kinds you can download on your phone. I use one called Period Tracker. It's a pretty simple app, and it's nice because, I mean, on the one hand, it calms you down when you look and see, oh, okay, I'm feeling extremely bloated and I ate all this chocolate, but I saw that last month I went through a similar thing and then my period came in. It allows us to know ourselves a little bit better. I think a big part of us, so I'm not the kind of medicine I practice, and I think a big part of naturopathic medicine is to empower someone to take their health into their own hands and to be their own doctor most of the time, right? I mean, we all need our own practitioners, but to be able to manage our own symptoms, to recognize, oh, this is, my blood sugar dipping, and I understand what this symptom is, and I'm not sort of at the mercy of these changes in my body, and I know how to heal myself. I know what to do. And so it gives us that knowledge when we're tracking our periods, to be able to really get to know ourselves and our cycles, and to see how, even if we are dealing with that week before or while we're in the process of healing our hormones, to be able to see, wow, okay, the week before my period, I really notice a switch where something happens, my hormone levels rise, or my body maybe just can't cope with the hormonal levels that it's experiencing, and I'm getting these symptoms. And then as soon as my period comes, maybe not right away, but maybe the second day of my period, when the cramps are finished, I start to notice that I'm all of a sudden, like, somebody kind of cleaned the windows in my house, like everything is clear and I feel much better. And to be able to get that knowledge is really useful. Also, to be able to track and see, what's a typical cycle for you? How long do you menstruate for? How often does your period come? Do you skip any cycles? Do you have shorter cycles? Have you noticed a change in how heavy your cycles are, how painful they are, or the premenstrual symptoms you experience, like breast tenderness? And so all of these things are really helpful for us to see and for me to assess, to sort of figure out and map what's happening throughout the month when it comes to the ups and downs in our hormones. Yeah, so I love tracking it. It's also really exciting because there's a big button in this app in particular that you can press that's like, period came. And then you can also press it, period's done. And you're just, I don't know, it's like, feels like, yeah, it's like, you're like, I can't wait to hit the button. You're like a kid again.
Oh, so that's an exciting app called Period Tracker.
Period Tracker. People use one called Clue. They're typically used for fertility because it tells you when you ovulate. Okay. So, I mean, it bases your ovulation on a prediction of, of how it's seeing your cycles play out. But it can be useful for timing, intercourse so that you can get pregnant, or for avoiding pregnancy. So it really just gives you that information into your cycle, because often we don't think about our cycles anymore than, oh, okay, it's my period, I need to go and buy some tampons. So to be able to understand, wow, my body is going through all these changes every single month and at different times of the month, and those changes can affect how I feel and decisions I make and how I respond to things in my environment, how I view my own life. Like, that could be really powerful information to have.
So if there's a starting point for somebody who wants to help with her hormones, who really needs to heal her hormones or even understand, and she's trying to do it all by herself, like maybe trying to clean up her diet, what's your favorite tip to give such a person who's on a journey to help balance her hormones out?
Yeah, the first thing, I mean, I'm a big fan of using functional foods first. And functional foods are normal foods you can find at the grocery store, but that they have almost like an herbal therapeutic benefit to them. So they're very safe to do, because you can't really overdose on something. When you think of a medicine, it's a very, very tiny pill. You think of an herbal or natural medicine, it's a little bit of a bigger pill. Then you think of food, you're eating cups of this substance. So the chance that you're going to overdose or make a mistake is very low. But there's a few things that we need from food that can help us with proper hormonal cycling. And big ones are fiber and greens. And fiber, because it helps to bind up the estrogen. We talked about how estrogen can be eliminated through the gut. It binds up the estrogen in the gut and helps it get eliminated out of the body. And my favorite fiber for that is ground flaxseed. So often, I mean, it may not be enough or a strong enough therapy for someone who's got severe symptoms or significant symptoms, but a couple big heaping tablespoons of ground flaxseed in a smoothie, in your yogurt, in even a bit of water, is really helpful for acting as a fiber that can help clear estrogen, but also flax has it contains a phytoestrogen, which regulates our estrogen levels. So if your estrogen is too high, it competes with estrogen binding and brings it down. And if your estrogen is too low, like you're going through perimenopause or menopause, it acts as a very weak estrogen that gives you a little bit of that stimulation to your receptors. So you can't really go wrong because no matter what's going on, flax is balancing you out. So I love flax for that. And then the other one are the dark leafy greens and cruciferous veggies. So the broccoli family, the sulfurous vegetables. A lot of these sulfurous compounds, like indole 3-carbinol, which is in like red cabbage, or calcium D-glucarate. Like there's these different substances that we find in greens that help with our liver detox estrogen. And also a substance called choline, which we talked about eggs, and egg yolks actually contain something called choline, which helps us bind and methylate our estrogen. So it kind of binds up estrogen, helps the liver get rid of it so that we can eliminate it in the gut. So adding in a cup of greens a day and a couple of tablespoons of ground flaxseed would be a great place to start. So we talked about there's a manual that we're offering for free that has some recipes that people can try, but you basically throw those two ingredients together in a smoothie with some fruit and a protein powder. That's a great place to start to help with smoothing that hormonal roller coaster a little bit more.
Oh, thank you so much. That was really good information. So where can somebody find you? If somebody wants to contact you, what's the best way to reach you?
So the best way is my website. So my website has a connection to all my social media and my email, which is connect@taliamb.com. So unfortunately, I can't give health advice to people who aren't my patients, and I can only see patients who live in Ontario. But I have a lot of information on my website. I try and post frequently and write articles on mental health and hormones. And I'm trying to post daily on Instagram. So with just little health tidbits like this, talking about how estrogen can change our dopamine levels and how dopamine can affect our motivation and things like that could help to educate somebody a little bit more. And also to be in contact for programs like this, where someone can deep dive into more information to understand how their mood is affected by all these different things that are going on with them. So my website's a great place to start. And from there, they can kind of springboard into all of the different offerings and pieces of information that could be helpful.
That's awesome. Thank you so much. So if you want to visit Dr. Talia, you can go on her website, drtaliand.com. She's also gifted the perfect periods guide, which could be a great start point for you. So kindly click on the link below to access the guide. And if you're loving this summit as much as I'm loving interviewing all our great experts, please click on the link below to download, to check out the bonus package and download it so you can have all the interviews at your go. Thanks, and I'll see you in the next interview.